हाँ जी फ्रेंड्स, वेलकम करते हैं तुहाडा सारिਆਂ ਦਾ नर्सिंग करियर चैनल ਦੇ ਉੱਤੇ। सो ਜਿਹੜਾ CHO ਦਾ एग्ज़ाम आ काफ़ी नेड़े आ रहा, सो काफ़ी हैल्पफुल वीडियोस ने ਤੁਹਾਡੇ ਲਈ। वीडियो ਨੂੰ एंड तक जरूर देखा करो तो चैनल ਨੂੰ सबसक्राइब भी कर दिया करो। सो स्टार्ट करते हैं फर्स्ट क्वेश्चन। In case of fracture and joint dislocation, so which of the following first aid measure should be taken except? So in the case of fracture and joint dislocation, so which of the following first aid measure should be taken but except? So rest the injured part, ambulate the patient, compress with the bandage, elevate the injured part. So rest the injured part, compress with the bandage, elevate the injured part. So all are included in the first aid measure but except the right answer is ambulate the patient is not a part of fracture and joint dislocation, not included in the first aid measurement. Ambulate the patient. So option B is the correct answer. Next question. Hydrophobia means fear of water is common in insect bite, scorpion bite, dog bite, snake bite. So hydrophobia is most commonly in a dog bite patients. So option C. Next, move to the third question. The life-saving golden hour for an accident victim to receive medical care is first 1 hour, first 2 hour, first 3 hours, later. So life-saving golden hour for an accident victim to receive medical care is first 1 hour. So option A is the correct answer. Next, move to the other question. Heat loss in a newborn can be prevented by which of the following except? So heat loss in a newborn can be prevented. It's a drying, wrapping, breastfeeding. All are can be prevented by the heat loss in a newborn but except. So except means keep infant cot close to the walls and windows. So the right answer is option C क्योंकि उन्होंने except पूछा. So next, move to the other question. Exclusive breastfeeding will save the baby by preventing all of the following except. Breastfeeding will save the baby by preventing all of the following. So breastfeed is very important for newborn babies. So it will prevent from the diarrhea, pneumonia, malnutrition. But except malnutrition, overnutrition. So the right answer is option D, overnutrition. Next, other question. Failure of baby to breathe normally is known as dysphagia, aphasia, suffocation, cyanosis. So failure of baby to breathe normally is known as aphasia. Option B is the right answer. Next, one of the following infections in low birth weight babies that require immediate referral to higher health facility: acute respiratory distress, otitis media, congenital malformation, pharyngitis. So one of the following infection in low birth weight babies that require immediate referral to higher health facilities is acute respiratory distress. Option A is the right answer. Next, another question. All of the following are true about criteria but except an infected person hiding infectious agent does not show any evidence of disease, one can live safely with carrier, service as a source of infection. So all of the following are true about criteria. Infected person hiding infectious agent, don't show any evidence to disease, service as a source of infection, but except पूछा उन्होंने. So one can live safely with career. So option C is the right answer. Next, source of infection for neonatal tetanus is. So what is the source of infection for neonatal tetanus is? Use of non-sterile instrument in cutting cord, oral and throat secretions, fecal oral route, direct contact. So source of infection for neonatal tetanus is use of non-sterile instrument in cutting cord. So option A. Next, contaminated blood is the main source of infection for causing gastritis, hepatitis B, hepatitis A, nephritis. So what is the contaminated blood is the main source of infection for causing a hepatitis B? Option B. Next, all of the following are live attenuated vaccines except hepatitis B, BCG, oral polio vaccine, measles. So all are the following live attenuated vaccines BCG, OPV, measles, but except hepatitis B is not a live attenuated vaccines. Option A is the right answer. Next, BCG is contraindicated in the case of fever, diarrhea, person or immunosuppressive therapy, blood cancer. So BCG is contraindicated in the case of person or immunosuppressive therapy. So option C is the right answer. Next, one of the following measurement used to detect malnutrition in children from 1 to 5 years of age. It's a mid-arm circumference, chest circumference, head circumference, fontanelle closure. So one of the following measurement used to detect malnutrition in children from 1 to 5 years of age. So check the mid-arm circumference, option A. Next, deficiency of vitamin leading to 3D, that is dermatitis, dementia, diarrhea is vitamin B3, vitamin B6, vitamin B2, vitamin B12. So deficiency of vitamin leading to 3D, dermatitis, dementia, diarrhea is vitamin B3, option A. Move to the next question. Folic acid during preconception periods prevent neural tube defects, malnutrition, anemia, diarrhea. So folic acid during preconception period prevent neural tube defects. So folic acid during preconception period prevent neural tube defects. Option A. Next, first antenatal visit to health facility should be done 9 weeks, 12 weeks, 11 weeks, 10 weeks. So first antenatal visit to health facility should be done at 12 weeks. Option B. Next, essential laboratory investigations during antenatal period includes all of the following except pelvic X-ray, hemoglobin, urine sugar, albumin, blood sugar and RH type, VDRL and HIV screening. All the essential laboratory investigation during antenatal period, but pelvic X-ray is not recommended in a pregnancy time. So option A, pelvic X-ray. Option A is the right answer. Next, all of the following symptoms indicate during pregnancy: fever, breathless at rest, heartburn, severe headache. So fever, breathlessness at rest, severe headaches, but heartburn is not symptom that indicate during pregnancy. So option C is the right answer. Next, most probable diagnosis of pregnant woman with puffiness and face and generalized edema is anemia, gestational diabetes mellitus, pregnancy-induced hypertension, hyperemesis gravidarium. So most probable diagnosis of pregnant woman with puffiness of face and generalized edema is, that is, pregnancy-induced hypertension, option C. Next, we will move to the next question. Which is the most common complication in mothers? Which is the most common complication in mothers with gestational diabetes? Preterm labor, polyhydramnios, intrauterine growth restriction, low birth weight delivery. So it's a polyhydramnios. Option B is the most common complication in mothers with gestational diabetes. Option B. Next, psychiatric abnormalities along with cholesterol deficiency is a characteristic feature of Atlantic anemia, megaloblastic anemia, sickle cell anemia, iron deficiency anemia. So psychiatric abnormalities along with cobalamin deficiency is characteristic feature of megaloblastic anemia. Option B. Next, the formula calculate the body mass index. Weight in kilograms, square of height in meters, weight in grams, square root of height. Next, C, height in metro square, weight in kilograms, and last is height in millimeter, weight in kilogram. So formula calculate body mass index is weight in kilograms into square of height in meters. This is a body mass index formula. Option A. When helping a stroke patient, nurse should assist from which side? One weak side, one strong side, and from behind, from back. So when helping a stroke patient, nurse should assist one weak side. So option A. Next, following are the methods of induction of labor. Except so oxytocin, prostaglandin, methargine, artificial rupture of membrane. So oxytocin, prostaglandin, artificial rupture of membrane are all the method of induction of labor, but accepted answer is methargine. It's not a method of induction of labor. So option C. Next, if the maternal alpha fetoprotein level is 28, which among the following condition may present? Meningomycel, meningocele, both A and B, Down syndrome. So if the maternal alpha fetoprotein level is 28 ml, which among the condition may present? It's a Down syndrome. Option D. Next, what is a proportionate weight to the placenta to the baby at a term? 1:2, 1:8, 1:6, 1:10. So 1:6 is the proportionate weight to the placenta to the baby. Term is 1:06. Option C. Next, types of pelvics in which the feature are head shaped brim, narrow and for pelvis, and sciatic notch with prominent ischial spine and suprapubic angle less than 90 degree. So it's a gynecoid, android, anthropoid, platypoid. So the right answer is android. Option B. Next question. A nurse is caring for a patient with swine flu. Which medicine is the best to treat swine flu patient? Icoclovir, oseltamivir, adidofir, remdesivir. So the right answer is to treat the swine flu patient, best medication is oseltamivir. Option B. Next, loss of muscle coordination result from damage to hypothalamus, midbrain, cerebellum, cerebrum. So loss of muscle coordination result from damage to cerebellum. Option C is the right answer. Next, weak portion of arterial wall may bulge out, forming a sac which is known as arteriosclerosis, aneurysm, arteriosclerosis, anastomosis. So weak portion of arterial wall may bulge out, forming a sac which is known as aneurysm. So option B. Next, from which part of brain CSF is secreted? Choroid plexus of brain, venous sinus of brain, subarachnoid space, none of the above. So CSF is secreted by the choroid plexus of brain. So option A. Next, all of the following are the bones found eye hand except carpal bone, calcaneum, phalanges, metacarpals. So all of the following are the bones found eye hand, that is calcaneum, option B. Next, when convex surface fits into concave surface is called plane, hinge, saddle, ball and socket. So it's a hinge, option B. Next, which of the following is the function of liver? Elimination of carbohydrates, concentration of bile, synthesis of plasma protein, secretion of cholecystokinin. So it's a function of brain is synthesis of plasma protein, option C. Next, medical management for increased intracranial pressure include administer mannitol, administer half strength saline, administer plasma volume expander, reduce the number of breath in ventilator. So medical management for increased intracranial pressure is administer mannitol. Option A is the right answer. Next, the expanded form of ESR is electrolyte sedimentation rate, enzyme synthesis rate, erythrocyte sedimentation rate, erythrocyte synthesis rate. So expanded form of ESR is erythrocyte sedimentation rate. Option C is the right answer. Next, isometric exercise is a dynamic passive exercise, isotonic, done in static position. So done in static position, option D. Next, last question today's video. Diluent used for BCG vaccine is distilled water, normal saline, dactylose solution, ringer lactate. So diluent used for BCG vaccine is normal saline, option B. सो काफ़ी इंपॉर्टेंट क्वेश्चन सी वीडियो ਨੂੰ ਐਂਡ ਤੱਕ ਜ਼ਰੂਰ ਦੇਖਿਆ ਕਰੋ ਤੇ ਚੈਨਲ ਨੂੰ ਵੀ ਸਬਸਕ੍ਰਾਈਬ ਕਰ ਦਿਓ। ਓਕੇ ਗਾਇਸ, ਮਿਲਦੇ ਆਪਾਂ ਨੈਕਸਟ ਵੀਡੀਓ 'ਚ।